What's up, guys? I'm Dr. Donald. This is Dr. Kevin, and this is Dr. Ben. And we are Kinetic Impact, if you can see back there. And we wanted to talk to you guys about the importance of baseline testing, especially for those who are involved with sports with a lot of running, cutting, jumping, like volleyball, soccer, those who are at high risk for ACL injuries. We see a lot of ACL rehab clients who have gone to PT and just in general, the re-injury rates for ACLs are kind of really poor. About 1 in 5 athletes re-injure an ACL when they get back to playing a sport. And I think from the rehab side, it can be a lot better. And the stories we hear is a lot of underloading, underdosing, really, we want to talk about the importance that baseline testing has in that world. But anything you guys want to add on to that first part?
Yeah, I think in terms of like people that fail ACL rehabs,
Yeah.
they don't have enough challenge throughout their whole entire process. They may not have like a full strength and conditioning program that takes them through the whole spectrum of rehab to performance. Maybe they don't get introduced to cutting. Maybe they don't get introduced to hide, change of direction movements during their sport that they have to do in their sports, or they don't get the capacity to tolerate those demands. So then people say they fail PT, but maybe the PT failed them.
Yeah.
So we need to kind of look back at, okay, what is the demands of the person for their sport, and how do we get them there? So now you understand what they're doing. We can go back and not create a program that makes sense for them throughout the whole entire spectrum of the rehab process.
Yeah, and I think it's pretty rare to find a clinic that has really good knowledge on the strength side of the house. And once they get past like that swelling and range of motion, because I go back to what you were talking about, the demands of the sport, right? Like deceleration could be up to 6 times your body weight when you hit the ground. And that's some forces that's even hard to touch in the weight room. So you got to be really
Absolutely.
knowledgeable of how to recreate those things, even as a strength professional. So
Mhm.
I think you're right. I think there's a lot of low hanging fruits that I think we need on our end as a whole field to give to people to make sure that those re-injury rates aren't 20% because that's really freaking high.
Yeah.
Anything you wanted to add on in regards to the importance of like the PT
Yeah,
in
I
that
think
early phase?
yeah, I think just to go back to a couple of things on why baseline testing is super important for any kind of athlete that's cutting is moving away from a timeline is we're not set up that right way. Like our bodies aren't set up to heal at the same rate. The demand of each sport gets factored in. So it's very individualized, right? We still need to be able to do that. And by creating situations where we have KPIs, key performance indicators, understanding of where your symmetry is at currently, what your limb strength is, doesn't just give us like a guideline of where you should be. It gives us a guideline of where you were and that we need to get back to it. Another thing to think about is like for athletes, the better the athlete is, the more the athlete plays, the higher degree of likelihood that they're going to potentially have an injury. One way to just kind of look at risk mitigation is we know if we have asymmetries early on, we might be able to address that with like a young athlete and go, hey, here's a gap in your strength and conditioning program, very low hanging fruit. And this may have an outcome of risk mitigation. Right?
Yeah.
The likelihood that they'll get hurt is the more likely that they play. But just having them better prepared for it and better testing standards to understand what we need to get back to is great. And the other thing is with baseline testing, we do have normative value and data sets over different ages and different sports. So
Yeah.
we can see where they should be for the current level that they're at and the next level that they want to get to. And understanding that, those kinds of adaptations and process and maturations occur over like long time periods, right? Like we're talking over a year. So you throw in addition of things like injury, it definitely, without understanding of where we need to go, can create a little bit of a witch's brew for bad things that happen of trying to go like this person should be ready to play because it's been this long versus this person should be ready to play because we've tested these things.
Mhm.
Yeah, I think it'd be helpful too to rewind a little bit and talk about like what those baseline tests kind of like what that looks like, right? And exactly what they are. We could talk in a whole nother video about exactly what baseline tests we like to use, whether you have tech or not. But I think rewinding in regards to kind of what it is, whether that be a jump test, whether that be isolating the muscle strength, right? It's just looking at those in a general sense, physical qualities of strength, being able to produce absolute peak force, being able to do it quickly, and being able to express your body with some sort of power movement, right? And that gives an idea, like you were saying. Now you have a baseline or certain criteria you need to meet, whether that be compared to your body weight or compared to other people in your demographic, if you will, right? So now you at least have a North Star to go towards, and it's not just, hey, for an ACL, oftentimes what people are told is you got to wait 9 months, and it gets lost in translation. And now this athlete is just super bummed and just, okay, I just have to wait 9 months, and really that's not how it works. You got to train your butt off, and you got to hit these measures, and the best way to look at it is you should be just as strong as you were when you be pre-injury, or actually stronger because you got the injury, right? So I think having true baseline is really helpful, and this is where I'm going to come back to it. I think having a true baseline and knowing what you were pre-injury is much um, more beneficial than just comparing to a non-injured leg. Um, and I kind of want to like shift to you, Kevin. And I want to ask like why that is, why that's so helpful during this process to have like a good baseline where you know what the strength is pre-injury. Let's say I'm gonna give example. The athlete is healthy, and we were just working with them. For an example, we have somebody, right, and you're working with her, and you know what her strength was prior to the injury she occurred. So now you have that baseline in comparison to having numbers after they were injured.
Yeah, so the reason that you want to have a baseline prior is because now you want to know what they're doing when they're at their peak performance. So you understand what they're doing at their peak performance, you kind of know where they kind of need to go back to. And unfortunately for ACL, sometimes it's not predictive of like what causes an ACL injury. If you're, like Dr. Ben was saying, like you're on the court playing more minutes, your risk of injury is going to skyrocket. So having these data is very important. Knock on wood, if somebody gets hurt or they get injured, what are their baseline and what were they doing when they were at their best during the season,
Yeah.
during preseason. So when they do get hurt, now you go back and look at it. Okay, they were producing X amount of force during this time. So this is kind of where we need to get to at least as a baseline. But the baseline could possibly be what got them hurt because maybe they're not strong enough, maybe they're not reducing force enough. So now we may have to push beyond that ceiling to allow them to have more capacity to tolerate higher forces, higher levels of sport activity.
Yeah.
So
Yeah.
now, while you test later on, you might get a false asymmetry because your opposing leg, the one non-injured side, may have gotten detrained and it might have gotten weaker.
Yes.
So let's say prior to injury, your left leg, the non-injured side, was producing 115 pounds of force. All right, but when you test later on, kind of like maybe like 5 to 6 months down the road, they are only achieving 95 pounds of force right there. So there's a decrease, and then now you compare your injured side with your non-injured side. You're actually comparing a weak leg to another weak leg.
Yeah.
So we need to push the envelope of, okay, what are they producing prior to the injury? So then now we know this is where they need to get back as a baseline, not what they're currently got measured at, because that baseline is just a false representation of what their true strength
I
is.
think that's huge. I think, dude, this is what I always get so like, oh, this makes such logic sense, but we don't think about it. And it's when they get injured, how long does it typically take to get an MRI?
Mhm.
Right? We're talking 2 to 4 weeks on a normal
Yeah.
base, unless you know somebody, right? And then another 2 to 4 weeks to get surgery. And if they're not doing, if somebody's not doing something, an athlete's not training for that period of time for 8 weeks,
Mhm.
there's already strength loss,
Yep.
right?
Mhm.
So think about that, right? And then now you probably don't measure it for another 2 to 4 weeks in rehab,
Mhm.
right? Because that's typical standard. So now we're talking about 3 months of deconditioning where you have the a non-injured leg that you're comparing to and trying to get it as strong as the non-injured leg, which is now already deconditioned. And I think, and that's like the good standard.
Yep.
That's actually using a criterion base.
Correct.
If they're using a criterion base and not just a timeline, right? So
Yeah.
I think this is where I think if we gotta be picky here, because I think there's the only way that these numbers get better is if we actually use the return to play criteria and a true baseline, like you were saying.
Mhm. And then once you get that true baseline, then you can compare it to the normative values of people within their age group, within their position, and within that bracket. So now, okay, we got to their baseline. What is the next level of baseline of performance that they need to get to? So
Yeah, so-
now are they with under that threshold?
Yeah.
Maybe we need to push them
And you're
stronger.
talking about like the database that like Bald, for example, pulls from, where they
Correct.
have like hundreds of examples of, okay, they know that they're a NCAA volleyball players,
Mhm.
and they pool and they're like, okay, if you want to play NCAA volleyball and you're a female aged 18 to 20, this is what their normative values are. Now you
And-
have that North Star because you want to play D1, you want to play NCAA
Yeah.
volleyball, and that's what you want to be.
And there's also percentiles, like, okay, what percentile are you in? Are you in the 90th percentile? Are you within the 75th percentile? So now you have a understanding, okay, maybe I am not actually ready. I feel good, but maybe we're still missing some pieces in terms of getting back to return to play. Like you could maybe return to practice, return to participation, but to be out there and play, you might be still missing some sort of high level performance.
And I know, like, I think it was Matt Jordan talking about there's motor deficits all the way like 2 years down the road in regards to like changes in ACL. So I know that people are in a rush to get back, but I think at least having these criterias where you can get actually close enough to your baseline, at least you have something to shoot for, because it can be frustrating. Like there's and also something people don't talk a lot about is being confident again,
Yep.
right?
I think the psychological readiness is just as important as getting your physical readiness, because now you have inhibition. If you're strong enough, but you're still afraid to hit the ground,
Yeah,
you're
brain
still
inhibition.
yep.
Yeah, and you've had ACL surgery,
I've
so
had
I'm
ACL
sure
and I've
you've
had-
felt
I've-
that before.
I've had that experience, right? That lived experience of uh, just lack of deconditioning. Like my story was just really a bad situation. It was like the
Sure.
worst, terrible ACL situation. But as I was coming back and building strength and getting stronger, there was so much. You just gotta earn trust within your body, right? And that takes time. I think this brings up a couple really really good points. That's why you would want to be able to have this for rehab purposes. If you're trying to prevent injury, potentially using this as a scale to see where you need to go. And in the upper 90 percentile, these are where these people are for these specific tests. So this is where my program should be going. If you're currently doing a program, it can be something that can be used to test how well your program's doing, or simply your levels of fatigue, which is why testing frequently gives you more true data, right? Is where my athlete really is over a time period. So there's a lot of value from both the rehab and performance side of the house.
Agreed. It gamifies it a little bit too, right? You have something to shoot for. I think that is very helpful on the rehab side, because it's a brutal long road, and anything you can gamify to give you a reason to push is great. And then from the training side, just being able, like having a goal to try to get towards, I think is beneficial.
And the last driving factor that's I think really important thing is, like you said, you're able to create a situation to get somebody taking power of it early on. So even if you don't have pre-testing, immediately after you test, let's get a baseline on your other side while it's still strong,
Yeah.
and you're going to be able to create
Like immediately after the injury.
immediately
Yeah,
after
I agree. I agree.
or within a short time period after the injury.
I think it's
Let's
extremely worth it.
baseline it right now. Now we know how strong this other side is. We also can realize, like, hey, this is a moment too where the athlete's going to be possibly fragile or just want to know how long is it going to take to get better. We just talked about how that's a very difficult answer. I think it's you can reassure them that it's going to get better, and here's what we're going to do along the way, so that you're jumping over things and you're continually getting gradually better and better and better throughout the process. It's not like you this whole deficit.
And you're proving it.
You're
Right?
proving it, and then you're also going to be this leg's going to get conditioned. We know that the opposite leg will receive conditioning effects by simply not allowing this other side to get deconditioned or building strength into it.
Yeah, I think very important. Most people also miss the boat in traditional rehab is not training the whole entire body.
Yeah.
The deconditioning effect.
Yeah.
The deconditioning effect is just as
We're an entire organism.
Yeah,
Yeah.
where you have an upper. Well, you only got one limb that gets injured, but you have your opposite, and you still have your whole entire upper body torso. We also want to train your whole entire nervous system.
You can train VO2 max with one leg on an assault. There's so many different ways to be able to create a very enhanced stimulus so that your overall training to your body can enhance while this leg is getting better. I mean, that's understanding that you are trying to still increase performance while one part of you is catching up.
Yeah, and going back to the nervous systems, like if you detrain your nervous system in like a speed and power athlete, within 5 to 7 days, you get a decrement of a performance decrease. So if you're able to keep some form of high neural drive throughout the whole entire process early on, you actually might be able to speed up the process more than you think, because now you're less deconditioned. Your ability for your nervous system to act, or rate code, remains intact, and you're able to still produce forces and every elsewhere in the body as the body catches up. Because if you're continuing to focusing only on the weak things, your whole body as a system will probably only get weaker. So build up your strengths and let the weaknesses carry on as the strength goes up. So if you're only building weaknesses, you're only getting everything else weaker. So the cross education effect is very powerful, because you can train the contralateral limb and have a huge effect in building, carrying over strength, possibly some hypertrophy too.
And not to mention like that circulatory effect.
Correct.
Right? Like with
metabolic
swelling,
system.
The
metabolic system in regards to like nutrients in and getting that recovery.
And then
it's gonna be huge.
Even when you train, you have a hormonal response, right? So you get an endocrine, you get growth hormone response from inducing a stimulus to your body in order to adapt to a stimulus. So when you rest for a couple of weeks, your body gets deconditioned, your tissue gets more fragile.
And those hormonal responses occur better under certain loads and certain stimulus. So you'll be able to still have a similar training schedule with your intensities if you are at have high intensities in there, just without that leg.
I think this is great. I think we should go into like a detailed video of what we think ACL rehab should look like. Even I think this is an awesome conversation. But to bring it back home, I think in conclusion, in regards to like baseline testing, if you want yourself or your child as an athlete to have a successful return to play, or even just reduce the risk of injuries, because all this stuff that is helpful for to train and rehab ACL is also helpful to mitigate the risks for ACL. Heavy weights and ballistic training decrease
power,
decrease the
coordination
risk, for future ACL injuries. So I think having the baseline, man, is, to me, in my personal opinion, if my family member were to go through an ACL injury, I would say immediately get baseline testing. If they were playing sports that had high risk, I would suggest for them to get baseline testing, because you want to know for sure what that North Star truly is. And it's going to be much more useful than just a timeline when it comes to return to play, and it's going to be much more useful to give yourself a North Star and a purpose and a reason to train and mitigate the risk for future injuries. Does that sound about right on the conclusion?
Yeah.
Okay, so and that being said, if you guys are interested in baseline testing, we'll do another video of what that looks like in regards to which ones we choose and which ones we suggest, whether you have technology or not. But if you're interested and you're in the San Diego area, we do offer that. So reach out, message us, or if you just have questions on it, please message us. We're an open book. So you can find us on Instagram, Kinetic Impact, and this is our YouTube channel at Kinetic Impact. So please message us. We want to talk about this stuff. We're nerds. So until next time, peace.